Hi, this is Dr. Bob Dannenhoffer. I'm the Public Health Officer for Douglas County, and this is another of our COVID conversations. Today is January 6, 2022, so this is our first COVID conversation for now, the third year of our pandemic. This is our chance to tell you about what's happening in the world, what's happening in the country, in the state, and here in Douglas County, and also a chance to answer some of your questions. We've gotten a number of really good questions this week, and if you have questions, please submit them to us at Facebook questions at douglaspublichealthnetwork.org. I'll repeat that later, but if you have questions, send them to us. We'll research the answers and get them to you. Well, there is a lot of news about COVID this week. The biggest news is about the Omicron variant. So the Omicron variant is the latest variant of COVID. It probably started in South Africa or Botswana, and it's just really rapidly spread. You'll remember it was only the end of November that it was first identified, and here now, 6 weeks later, it is the predominant form in most of the world. And the way it spread is just truly breathtaking. So it started first in Botswana and South Africa and really spread quickly, then spread to Europe, then spread to the East Coast, and now seems to be pretty much everywhere in North America. So when we look at the world point of view, we are seeing the highest number of cases ever. And this is not just like a few more than usual. This is twice the number we've ever seen before. So really a staggering number of cases. And this is despite the fact that there are very few cases in China and very few cases in India. So this is in Europe, North America, that we're seeing this real explosion of cases. We are seeing also some disease in Australia, which had not had much disease before. And we're starting to see an explosion of cases in South America, starting in Argentina around the big cities and now spreading out. Well, the Omicron variant, we'll talk a lot about it later, seems to be the cause of almost all of this spread. There's still a lot of the world who hasn't seen it yet, and we are concerned that this could really spread and really cause a lot of problems. But there is good news, and so in the second half, we'll get to the very good news about Omicron. In the US, we're seeing the highest number of cases ever, and not just a little bit ever, but we're going to have probably 1 million cases today. 1 million cases in a single day. That is truly shocking. That's going to be about 10 times the rate that we saw during the time in early December before COVID was here. And places that have been pretty quiet in December are now really blowing up. So the hottest place in the country is now Miami-Dade County, which is having 600 cases per 100,000 population per day. So Douglas County has a little more than 100,000. So that would be like us seeing 600 cases a day every day for a couple of days. You'll remember that in this terrible time we had last summer, we had one day with 300 cases, but we're typically in between 100 and 200. Can you imagine having 600 or 700 cases every day in Douglas County? But it does look like this is what's happening. When you look at the US, this is pretty much everywhere, although when you watch it grow, it looks like it starts around airports and then spreads out to New York, Washington, Atlanta, Chicago, Denver, Los Angeles, all of these places that have big airports, especially international airports. It starts and then it very rapidly spreads. In Oregon, we went from just a few hundred cases a day just a week ago. We had 6,000 cases yesterday. 6,000 cases, which was 2,000 above our previous record. And these 6,000 cases are really spreading rapidly, mostly, again, in big populated areas. So Lane County, Deschutes County, and the Portland area are really seeing an explosion of cases. And the doubling time, that is when you go from a number of infections to double that number, appears to be 3 days, which is basically what we've seen in other areas. In Douglas County, we've not hit those big high numbers yet. We're still running between 50 and 110 cases a day, which is still much higher than we were before, but considerably lower than those other areas around us. But looking at the way this is spread in places like upstate New York and in Maine, it is almost certainly going to get to us within the next week or two. So that's what we're seeing in Omicron. So we would expect a huge number of cases. over the next couple of weeks. The cases are now everywhere. We're seeing them in schools. We're seeing them among workers. We're seeing them among patients in the hospital. We're seeing it among workers in the hospital. So we're really seeing this everywhere. And this germ is thought to be really contagious. So let's talk a little bit more about Omicron. So Omicron probably developed in November of this year. It did not come from Alpha or Delta, because Alpha or Delta has mutations which are not in Omicron. It probably came either from an ancestral form or an old form of this disease from back in 2020, then developed a lot of mutations and then spread very quickly. It has got a lot of mutations in it. It does not have many of the mutations that Alpha and Delta has, but has many new mutations. And these new mutations seem to cause several changes from the old Alpha and the Delta. So Alpha and Delta were slightly different, but were like brothers. These are like just two random strangers on the street. This is really very different. And how is it different? One is it seems to be really contagious. So there are a number of studies that suggest that if somebody in your household gets it, you're going to get, and you're susceptible, you're going to get it. So it's really very contagious. The second thing that we see about this is that it attacks different places. So the Alpha and the Delta were especially deadly because they seem to attack your lung tissues. And almost all of the disease and almost all of the death that we had from Alpha and Delta were due to lung issues. So, we had a lot of people in the ICU, a lot of people on oxygen, a lot of people on ventilators, a bunch of people on this ECMO stuff. And it also seemed to cause clotting. So we had a lot of people with clots from this. Omicron doesn't seem to do that. It seems to be much more in the upper airways. And so when we talk about upper airways, we're talking about the nose, the mouth, the throat, and the areas above the lungs. And so it seems to cause much more upper airway disease and less, although not zero, and less lower respiratory disease and less clotting disease. Again, not zero, but less than before. And so with that, what we're seeing is we're seeing fewer admissions to the ICU for oxygen and ventilation. We're seeing fewer deaths, which are all great things, but we're seeing more pediatric hospitalizations. So the number of pediatric hospitalizations around the country is way up. So this is something I look at every day. And even during Delta, we had 250 or 300 admissions per day. Over the last week, we've had 700 admissions a day in pediatrics. And again, that's not surprising. Kids do struggle with upper airway diseases. So if you think of upper airway diseases like croup, epiglottitis, bronchiolitis, those are pretty much pediatric diseases. And so kids, because they have really small airways, they really do get bothered by this. So the one worrisome thing about Omicron is the increased number of pediatric admissions. Now, the good news is we've not had a lot of increase in pediatric deaths, so that is good news. But Omicron does seem to be a different disease with more upper respiratory illness, less lower respiratory illness, probably a lower rate of hospitalizations, most certainly a lower rate of ICU admissions, and probably a lower rate of deaths. But if you have a lot of cases, if you have 500 cases a day in Douglas County and still have 1% of the people getting admitted, which would be a low admission rate, you'd still have a lot of people at the hospital. So the good news, though, is it seems that Omicron is a little less serious overall. Now, with Omicron, we've had severe cases, hospitalizations, and deaths. So people can get sick from this. So it's not totally benign. The other thing that we're seeing from data back east is that vaccination really does seem to work. So people have a completed first series that is either one J&J vaccine or two Moderna or two Pfizer, seem to get about 35% protection from getting the disease. And if they get the disease, they seem to have a mild case. Now, if you have your initial series plus a booster, it seems that you have about 75% protection from getting a case and really a lot of protection against hospitalization. So when they look in the hospitals back east, most of the hospitalizations are among people who are unvaccinated. So it still shows that the vaccine works. So if you've gotten a vaccine and need a booster, please go ahead and get it. We have a vaccine clinic running every single day from 10 to 5 in the Fowler Street lot, which is across from the Roseburg Public Library. They're working 10 to 5. You can just drive through and get your vaccine. I was there yesterday. They did 80 and they're doing a beautiful job of that. So get it. Now, people say, well, it's maybe too late already. Omicron is already here. It's really not here yet very much in Douglas County. So you still have time. We know with the booster, it takes maybe 2 weeks to get full effect, but you get good effect even a few days after you get it. So please, 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 if you're due for a booster, go ahead and get it. If you've not had any vaccines, even one vaccine will help you some. So please go ahead and get the vaccine. So Omicron is there. Omicron is going to be the big deal. So how will we approach it? Well, for those of you who've been watching me over the time, know that I always like to sort of relate this to something else that people would understand. So imagine you're a gardener, and I'm a kind of amateur gardener, not very good at it. And when things are great and there's not very many weeds in your garden, you go out and you pick every little last weed. You find the weeds, and if there's one of them, you look for any other seeds that are there and pick them through. And that's kind of what we do when we have a low case count. And then finding the weeds and finding their relatives is kind of what we do with case investigation and contact tracing. And we're pulling out the last little weeds so that our corn grows unimpeded. Right now, we're in a big hailstorm. We're at a time where it is just pouring rain out there with the amount of Omicron cases. And during a pouring rainstorm, you're not going to be picking at the last weeds. You're going to be protecting your crop from getting flattened by the hailstorm. And that's really where we're at now. We do not think with this level of disease that's coming that we can do the case investigations and the contact tracing that we did before. At this point, we're really just trying to protect the hospital from getting overloaded and to be sure that we have services available for those people who are going to get sick. Now, with Omicron, if we look back east and in Europe, about 90% of the people who get Omicron, especially those who are vaccinated who had previous disease, are not going to get very sick at all and won't need any medical care. So I don't know what the exact number is going to be in Douglas County, but at least 3/4 of the people, 75 to 90% of the people in Douglas County who get Omicron are only going to be mildly ill. And if you're mildly ill, what you should do is stay home. So if you've got a headache or sore throat, a mild cough, a little low-grade fever, which are the typical symptoms that you see with Omicron, just stay home. You don't need to run out and get tested. You don't need to run out and get any treatment. You just need to stay home and not infect others. And so that's the recommendation. If you have what you think is Omicron and mild disease, if you have a test at home, get it done. If you can get a test, that's okay, but you don't really need to have a test. It won't really change anything we do. Stay home, try and not infect others, and then let you run it out. Now, the CDC has changed the isolation guidelines. It used to be if you had a disease, you had to wait 10 days. That's still far and away the safest way to do it. And if you can, that's what we'd recommend you do. But the new CDC guidelines allow that after 5 days, if you're afebrile, meaning your temperature is down without the use of Tylenol or ibuprofen, your symptoms are improved, and you're feeling better, you can go out with a mask for the next 5 days. And I think that's probably not unreasonable recommendation. So you can go out and do that. So let's say it comes into your house. I get it. My plan would be to lay on the couch for 5 days and watch Netflix until I was feeling better, my temperature was gone, and then go out again and do the things that you can do. So for most of us, we're not going to need to do anything other than stay at home for 5 days. If we get it, if it comes into a house and I get it, it's so contagious that anybody else in my house that's going to get it is likely to get it within the next 5 days while I'm still at home. And then they should stay home until they are feeling better. And then this can go through your family. The one thing we don't know is how much Omicron will protect you from future variants, because we don't know what the future variants are. We do know that previous infection with Delta or Alpha, so that is, you had an Alpha infection probably if you had it before April, probably had a Delta infection if you had it after July. They may provide some protection, although not perfect. But again, if you've had one of the previous kinds of COVID and then get this one, really, if you're not very sick, stay home. But so that's 75 or 90% of us can just stay home and not do much else. But there's going to be 10 to 25% of our population. And you remember, we have an older population here in Douglas County, so that's why I have that higher number. So we have an older population. And what they've seen back east is that people with other underlying conditions will sometimes have issues with Omicron. So one of the things that happens with Omicron is a bunch of stomach upset and some vomiting and a decreased appetite. Well, for me, I could go a few weeks without eating probably, but for people who have things like diabetes or people who are struggling to eat otherwise, not eating for a couple of days really could cause a lot of problems. For people with underlying conditions, they actually have underlying respiratory conditions. They actually have had some increased respiratory problems. So we know that 10 or 25% of our population is going to have some issues. And so if you get it, comes into your house, you have one of these underlying conditions, or if you're having serious symptoms. And what are the serious symptoms? So the serious symptoms would be shortness of breath, difficulty breathing, can't eat. I'm so weak I can't get up to walk around. I'm not thinking clearly. So one of those things really suggests that this is not your typical COVID, and there's either something else going on or COVID is making one of your other symptoms worse. So if you get those, what you need to do is you need to seek medical attention. And the way to do that is to call your doctor. So we met this morning with all of the big clinics in town. All of them recognize this is coming, and they are there to help. So our hotline has been going since March of 2020, almost 2 years now. Every day it's been going, and it's going to be beefed up in the next coming days. The clinics in town have all agreed to go ahead and have call centers, so that if you're sick and you call to Aviva or to UHA, to Evergreen, to Adapt, that they're going to have people that you can talk to about your COVID symptoms. Some of those can just be handled over the phone. So some may just be medication questions. I've got asthma. Should I take my asthma medicines while I get COVID? And those are the kind of questions they can help you with. You might have more serious questions like, yeah, I've had this for a few days now. I haven't been able to keep anything down, in which case you need some medical advice, and they will be there to give it to you. And so that's great. The other thing that we've arranged for the clinics in town is to have these little oximeters, oxygen monitors. So if you have respiratory problems and need to monitor your oxygen levels at home, they'll have those. And so they're going to try and keep as many people as they can at home. If they need to be seen in the clinics, they can. But really what we want to do is to keep people out of the emergency room unless they really need it. Now, we know that some people in our community will need to go to the emergency room. And they'll need to go to the emergency room because they do have one of those severe symptoms. But let's say we have 500 or 600 cases a day, and 10% of those need to go to the emergency room. That's 50 people. That will really strain the emergency room, but they can do it. However, if all 500 people who get this decide they need to go to the emergency room for whatever reason, they can't handle that. So we're asking people, if you've got COVID and you're mildly ill, stay home. If you've got COVID and have one of the more severe things or have questions, to call your doctor. And if you're more severely ill, call your doctor, and or only then should you go to the emergency room. So what kind of things should make you go to the emergency room? Well, if you call your doctor and they say to go to the emergency room, please do it. If you can't get a hold of your doctor, can't get a hold of anybody else, and have one of those symptoms, shortness of breath, difficulty breathing, difficulty keeping fluids down, or difficulty walking where you're previously able to, those are the kind of things that you should get seen for. But we're really, really, really trying to preserve the hospital things, because we know that there will be people who will need to get admitted. And if everybody goes to the hospital, they won't be able to do their work. Don't go to the hospital for a test, just for a test. I heard somebody back east say, going to the hospital for a test is a sure way to get the disease if you don't already have it. And so if you just want to know if you have the disease or not, if you're not seriously ill, it doesn't really make that much of a difference. So just stay home and stay well. The other things is that Umpqua Health Alliance has promised to help out people who are members of Umpqua Health Alliance, about a third of our community, who have other kinds of needs, and their member services are going to be available to provide other needs that you might have during this time. So we expect sort of a really bad COVID weather over the next few weeks. But the good news is, and if there is good news, is that this is washed through fairly quickly in areas. So South Africa started with disease in the end of November, and by the end of December, it had washed through and the number of cases was decreasing. It wasn't down to zero, but was decreasing. London started with lots of disease in early December, and it looks like they've hit their peak of cases and may be starting to come down. Tompkins County, which is the county in upstate New York where Ithaca and Cornell are, had a big outbreak starting in the very first weeks of December, and their numbers are already coming down now. That's not a perfect analogy because the students went home, so I'm not sure what's happening, but their peak didn't last long. We haven't seen any place with a peak that's lasted more than a month, but we're still not sure how long it's going to last in a place like New York, Washington, D.C., or Miami. Those places are into it 3 weeks and they're still going up. So we're not sure what's happening, when it's going to peak in those areas. But again, the thought is that it'll peak at some point, probably in Douglas County at the end of January or the beginning of February, and then it'll come down. And then we'll see if this protection that you get from having an Omicron infection gives you other protection. Because if it did, the really good news is that by March, people will be immune one way or another. They will either have had the vaccine, they will have had a previous infection with Delta or something, or they would have had Omicron, in which case they should be really pretty well protected. So, the good news is with this is it could blow through by the end of January and February. We could weather the storm. Now, we're not going to weather the storm without some hospitalizations and presumably some deaths, but we could weather this storm, and so that by February, things will start to look better. And by March, things could look a lot better. So that's my fondest hope. The other questions we got this week is about these home tests. So Oregon did order 6 million home test kits. The delivery plan for that is still being worked out. If public health is not going to get very many of these, but if we do, we'll have a distribution plan for people to get them at home. But again, my word is that if you're home, you're mildly ill, you don't need to get a test. If you have availability of a test, please go ahead and do it. So I bought some home tests a few weeks ago, and they're sitting in the cabinet. So if somebody in our house got it, I would go ahead and test them to see if they got it. One of the questions that came up this week is, do those rapid antigen tests work? So the rapid antigen tests, which are in wide use in Oregon, the Binax test, which is most widely used here in Douglas County, that does work. The iHealth test is another one that's widely used. That also one does work with Omicron. Another question came up about Regeneron. So Regeneron is this monoclonal antibody product made by the Regeneron Corporation, and it has been really quite effective with the Delta variant. So with the Delta variant, we've seen that it decreases the level of illness, seems to decrease the risk of hospitalization and decrease the risk of death. So it was really one of our go-to things during this pandemic. However, it does not seem to work at all against Omicron, and that really stinks. So we do not have Regeneron is not going to be one of the things we can use. There is one monoclonal antibody called sotrovimab, which does exist, and we do have a little bit of it, but the state only has a few hundred doses of this, so it's probably not going to be widely available for many of the people who need it. The other question is about the oral drugs, the Paxlovid and the molnupiravir. The molnupiravir is a drug made by the Merck company. Paxlovid is an oral antiviral drug made by the Pfizer company. Both have gotten approved. The companies, though, still have these in very short supply. We may start to get our very first doses next week, but we're only going to get a few dozen doses. And with a few dozen doses, that's clearly not going to be enough to treat everybody. And when we do get those doses, we'll be sure that they go to the people at highest risk. And the people at highest risk are people who are 80 and above. So we have a lot of people 80 and above in our community. And so we'll try and prioritize that medication for them. So there's a lot of news this week, a lot of questions. If you do have questions, please send them to us at Facebook questions at DouglasPublicHealthNetwork.org, and we will go and get to them. But again, if I had to summarize what we've done in a half an hour here, is that Omicron is here. Omicron is likely to really spread widely over the next month. Omicron in general is less serious. Most people with Omicron don't need to do anything other than stay home, and they should stay home for at least 5 days. And then until your fever's gone without the use of Tylenol or ibuprofen, and they should stay home until their symptoms are improved. If you're sicker with troubles eating, troubles breathing, troubles walking, you need to call your doctor, and we've arranged a system here that the docs in town are going to be available to take those calls. And again, the biggest news is don't panic. We're going to get through this. I think we've gotten through even worse times like we had with Delta. We're going to get through this, and I think we're going to do okay. Again, if you have questions, send them to us at Facebook questions at DouglasPublicHealthNetwork.org. Again, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County. Thank you so much.